You are welcome to my channel. Thanks for visiting, sharing, subscribing to my channel, and listening to this very presentation. Today, the topic is all about malaria vaccine. Some will say there is no malaria vaccine. Are they right? Not quite. Are they wrong? Not so much. In a bit, we'll know more. The only approved one as of today is RTS under the brand name Mosquitoes. In April 2019, in Malawi in Africa, a child known as Lusitana, I'm sorry if I didn't pronounce it well, please kindly forgive me, was the first child who had received malaria vaccine in the whole world in April 2019. Credit must be given to whom it is due, right? Walter Reed Army Institute of Research began this good job. And when was that? That was in 1984. Later on, they teamed up with GlaxoSmithKline, and in 1987, this journey started fully. With the help of the Gates and Melinda Gates Foundation, in addition to the non-profit organization known as PATH for Malaria Vaccine Initiative, more work became launched. Mosquitoes HW2300 is from GlaxoSmithKline. This contains RTS, Plasmodium falciparum circumsporosi protein fused or combined with hepatitis B surface antigen. It is also known as Plasmodium falciparum and hepatitis B vaccine. It is meant for active immunization. The spelling here is all about if you are in Europe or you are in North America, and it's expected in children from ages 6 weeks to 17 months. But by the time we go through the recommendation from World Health Organization, they did not agree with this definition. Mosquitoes, some would say, has low efficacy, but some will agree that it has modest efficacy. It's given as 4 injections and is expected to last for a year. Mosquitoes is active against Plasmodium falciparum. Good to hear, right? Plasmodium falciparum is the predominant plasmodium in Africa. Fortunately for them, that is the same plasmodium that this vaccine can protect against. To those outside Africa who will be battling with Plasmodium vivax, this vaccine cannot protect against Plasmodium vivax. Mosquitoes' mechanism of action. Mosquitoes acts at the level of pre-erythrocytes of the Plasmodium falciparum in the liver. And this is noteworthy. Why that? There are 2 major stages in the life cycle of Plasmodium. The erythrocytic stage is when we are going to have the signs and symptoms of malaria. That is when the patient will run to meet the doctor for treatment, or that is when he or she may die because he or she is down with malaria. The pre-erythrocytic stage, or the schizoid stage, or the hepatic stage will not give us signs and symptoms. But at that stage, they can then grow and multiply and then spread into the red blood cells and then give us the erythrocytic stage that will give us signs and symptoms. So at this stage, this vaccine will prevent further growth and multiplication, and then less infection because less will become erythrocytic. The sporozoids have circumsporocytes, and that is a form of protein on their surface. which they develop humoral and cellular immunity from the vaccine will attack. Okay, World Health Organization recommendations. This is not the type of vaccine that is meant for routine use in babies between 6 to 12 weeks of life. No. The first dose should be given at least at the age of 5 months. And then the second dose should be given 1 month after the first. The third dose should be given 1 month after the second. And the final dose is expected to be given 15 to 18 months after the third dose. Side effects. Pain, just generally like any shot or needle or vaccine or injection we give. Swelling at the site of injection is possible, and fever. There may be seizures within 7 days of administration of the vaccine. The implementation program. On October 25, 2015, Strategic Advisory Group of Experts on Immunization and Malaria Policy Advisory Committee, both within World Health Organization, jointly made recommendation to World Health Organization. The World Health Organization did not delay, did not tarry in carrying that out. 3 months after the recommendation, that is January 2016, who recommended RTS use for pilot introduction in 3 countries. The 3 countries we selected in 2019 by World Health Organization. The countries selected for pilot program are Ghana, Kenya, and Malawi. Then we expect this pilot program that is already ongoing to continue. This is 2021, right? This will continue until 2023. The pilot program by who? Who chose Africa for the pilot program? Because the Africans bear the most burden of the disease. Malaria vaccine was incorporated into the routine childhood vaccines in those selected countries of Ghana, Malawi, and Kenya. We are not done yet. Research is still ongoing. For example, I'll talk more about R21 matrix M in a bit. World Health Organization is directly supervising and overseeing the entire process. Kudos to them. The benefits of this vaccine. RTSS is given to children in the aforementioned countries of Kenya, Ghana, and Malawi. And there's a report that there's decrease in life-threatening or severe malaria already, and decreased malaria by about 40% and severe malaria by about 30% in the children who have received this vaccine. In all, there's a decline in the cost of malaria treatment and mortality. Good to hear, right? The progress report is that though in April 2019, Lusitana from Malawi was the first child in the world to receive this vaccine, but the journey has not ended there. As of today, thousands of children have received this vaccine. The rest countries are patiently waiting for what? For the final report for World Health Organization. Hopefully, it will not be long before they will obtain such, but it's not going to be earlier than 2023. In conclusion, we are not done yet. Research is still ongoing. And let me call your attention to this. Research on malaria vaccine had been in progress back and forth since the 60s, 1960s. They are still on it right now. So, for example, R21 matrix M is out there now undergoing trial, okay, right now. Some I've seen in some quarters that it is even more effective than Muscary's. Well, World Health Organization has not reached conclusion and they've not made any pronouncement. Hopefully, malaria vaccine will become available after World Health Organization's final report. And with that, I've come to the end of this presentation on malaria vaccine. Those who said that there's no malaria vaccine, they are not wrong because it is not as available as measles, mumps, and rubella. And to those who said malaria vaccine is available, they are not wrong, but it is limited to the pilot program in 3 countries of Ghana, Kenya, and Malawi only. With that, I think that we are now aware that World Health Organization is directly supervising this, and report will be out very soon in 2023, I guess, or maybe 2024 or 2025, and then a particular vaccine will be thrown out to the whole world to handle malaria. Thanks for listening. Remember to share. Remember to subscribe to my channel. I appreciate it.